Welcome to this program titled COPD Cases and Conversations, a focus on exacerbation prevention. During this program, I will discuss a series of patient cases centering on the potential challenges of COPD management with a particular focus on preventing exacerbations and mitigating patient risks. Let's first begin with a brief overview of the impact of COPD in the United States and the effects of exacerbations on our patients and the healthcare system overall. It's a leading cause of hospital readmissions, which is something we're all trying to reduce. Bad for patients, bad for the healthcare system. And the mortality rate after an exacerbation is 55%. So it's a really negative prognostic sign. So therefore, control of COPD and prevention of exacerbation is certainly one of the key points of therapy for COPD. So Sarah is 50 years old. She's new to your practice. She presented with a primary complaint of a cold for the past 2 weeks. And she's talking about this persistent cough, some wheezing. She's also felt out of breath. She has several colds per year, and the cold never entirely resolves. And so you have a patient who's with pretty mild to moderate symptoms, but they start to have more exacerbations. Move them up to a LAMA category. And I think that wouldn't be a bad choice to start off care for Sarah, along with the short-acting beta agonists, just for rescue therapy as well, and a lot of education. And of course, we're going to focus on lifestyle and smoking cessation too, right? We're going to get there, don't worry. What about those patients who have, fairly severe symptoms and as well also have a high rate of exacerbations or more severe exacerbations requiring hospitalization? That's group D, and now you really want to focus on combination therapies. So let's talk about Charles. He's a 66-year-old guy, and he's presenting with 7 weeks following a hospital discharge for acute exacerbation of COPD. This was his second hospitalization for a COPD exacerbation in the past 8 months. He was diagnosed with COPD 4 years ago and has been taking a combination LABA/LAMA as maintenance therapy for the past year. He's accompanied by his daughter who flew in for the visit. Wow, that's unusual. She states her father isn't a fan of going to the doctor. Aha. And while he always says he's doing okay, she can tell he isn't well. Double aha. She's very worried about his physical health as well as his low mood. So there's a lot of concerning issues here. So our audience brought up the potential for some of these psychosocial issues, such as access to health care, his current physical functioning and what he could do. And that's going to affect heavily, I think, his mental health. Based on his worsening symptoms, thinking about switching from a LABA/LAMA to triple combination or adding on therapies such as roflumilast or azithromycin. I think that roflumilast or azithromycin, we're not there yet when you look at the GOLD criteria. Roflumilast really is more for folks with that chronic bronchitis as well as COPD. I'm not necessarily sure that's Charles' main issue. Roflumilast is also associated with some weight loss, and he's a guy whose BMI is 20. And so I think that I would think about stepping him up. That exacerbation history, even though he's got the eosinophil count that doesn't necessarily dictate that he gets an ICS, he's not doing well. Especially if he's telling me, and I really believe him, that he's using his LABA/LAMA on a routine basis and using it correctly, then I would definitely increase him. It has been associated, with a lower risk of exacerbations versus LABA/LAMA therapy in clinical trials. So it also has been associated with lowering of the overall mortality rate, which is something that it's obviously really important, and I think can be emphasized as a kind of a broad statement, to help Charles, and especially his daughter is going to care about that, I think, quite a lot.